So part of the condition of epilepsy means that the seizure needs to be unprovoked, not caused by a reversible cause, such as head trauma, hypoglycemia, hyponatremia, intracranial infection, drug, or toxin. For example, someone that has alcohol dependence, you stop drinking alcohol, they have a seizure, that's not considered to be the condition of epilepsy because the cause is very clear and you can eliminate that cause. Similarly, for example, cocaine can cause seizures. If you use too much cocaine, you can have a seizure. If you don't use the cocaine, no more seizures. We don't call that epilepsy because the key for epilepsy is that it's a recurrent condition without such a cause. So here's another subtlety. It might be more appropriate to talk about the epilepsies rather than epilepsy, because in fact it's a group of disorders. Just the same way, if you went to a cardiology conference, you wouldn't talk about heart trouble. You'd have to talk about ischemic heart disease, or inflammatory heart disease, or valvular heart disease. It's all heart disease, but there are many categories, and epilepsy is like that. There's a nice book called Atlas of the Epilepsies, which came out in 2010. I'm one of the editors of that book. It's a 3-volume textbook. If you have any questions about epilepsy, probably the answer is in there. If you can lift the book, it's helpful. So big categories are genetic, post-traumatic, secondary to brain tumor, encephalitis, or stroke. So when someone has the condition of epilepsy, it's usually due to some abnormality, a fixed abnormality in the brain. This is for review. So this is my more manageable definition. So epilepsy is a condition of recurrent seizures. So one seizure is not enough, but if you have 2 or more, and it's not something you can very simply avoid by drugs or alcohol, or your serum sodium is too low, or something very easily correctable, then you have condition of epilepsy. Just another word so that we're all speaking the same language. Epileptogenesis. Development of a neuronal network in which spontaneous seizures occur. So epilepsy is a condition of recurrent seizures caused by epileptogenesis. For example, suppose a 65-year-old man has a stroke. So he's paralyzed on the right side, he had a stroke on the left side of his brain. 2 years later, he has a seizure. Why? From that lesion in his brain. But it didn't happen the day after his stroke. It happened 2 years later. So somehow, in the process of healing, the scar formation, the rewiring of neuronal connections, a byproduct of that is epilepsy in this particular, in about 5 or 6% of people with stroke. So that means, what's interesting about that, and why that's very important, is it means there's a window of time where perhaps there's a way to intervene with a medication or a therapy that might interfere with epileptogenesis and prevent that from happening in the first place. Any questions about these definitions? I'm belaboring the definitions a bit because as we talk about epilepsy, we all have to know what the words mean. Are any questions about that? There is a test later, so now's the time. Well, why is epilepsy, why should we pay any attention to it? How common a problem is this? Well, about a third of you raised your hands that you've seen a seizure, so this is not an unusual problem. In fact, about 50 million people in